This is Dr. Babak Azizzadeh. You are listening to the Smile Podcast, where I will be sharing with you my unique and holistic perspective on beauty, health, and wellness. Hello. Millions of people have surgery every year.
Or you could just get a boob job.
Using targeted Botox can be a miracle.
Smiling like that is a skill.
Your surgery has been successful. Hello, everybody, and welcome to the Smile Podcast. Today, I have a super special guest, Dr. Rebecca Fitzgerald, who has been a dear friend and colleague for so many years and just a world expert on dermatology and cosmetic and just knowledge beyond just dermatology. So we're very lucky to have her here today talking about kind of coronavirus and its impact on the skin and dermatology and cosmetic injectables. So we're going to talk about everything. So you guys have like evidence-based, up-to-date from expert rather than kind of information that we've been getting through social media. Welcome, Becky. Thank you so much for being here.
Thank you so much for that very kind introduction.
How are you doing? How are things going?
No, I'm doing okay. On my worst days, I start thinking, okay, we made it through a civil war, 2 world wars, the 60s, like we're going to be okay. This is going to pass. It'll be in our rearview mirror. And right now, I mean, we're not living somewhere with in a mud hut with no floors and, worrying about food. And so if it doesn't get any worse than this, it gets a little tedious, but it's doable. And I guess the silver lining is friends and family. My brother has a 13-year-old and a 16-year-old girls. I think you know that,
yeah.
Audrey. And I've gotten to spend a lot of time with them. And that's been the nicest part, because I think for adolescents, the biggest stressors in adolescence are sort of FOMO, or fear of missing out, and keeping up their image with other people. And that sort of melted away because nobody can go anywhere, and it's let them just be kids, and that's been a really kind of cool thing to watch and be a part of. But that said, I wish it would be over tomorrow.
Yeah.
And I wish that we had, instead of a new normal to go back to, I just want to go back to the old normal.
Yeah, we appreciate all the great things that we have, and we're grateful. I think it's a tough time for so many people who are kind of at the front lines. They're like in emergency rooms, or they're doing the delivery service for us, or they're at supermarkets, or working in the farms and, getting the food supply to us. So it's been really, really hard and stressful for them. And for others, it's the kind of time to reset and, rethink, hopefully not, the health crisis from, deaths and infections and ICU stays kind of goes down, because I know that's impacted so many of our friends, families, and hopefully that will go away. But yeah, it's been kind of like a reset. For sure, my kids who are 14 and 16, they'll never forget this time. And it will imprint on them majorly for the rest of their life, and hopefully for the better. They'll appreciate what they have, and they'll appreciate the normalcies. And for us, exactly what you said, just like really be grateful what we have and go back, to our normal lives. So, that's why I always say you're a wise woman, not just the amazing physician and clinician, but just your wisdom is awesome. And I agree with you.
And I appreciate your point too, for the frontline people. There was a suicide of a New York doctor, that ER doctor. Did you see that?
Yeah, I saw that.
And I think that after you've witnessed, it must just be, I don't know, just a terrible thing to have to witness all that suffering, and it takes a toll.
Yeah.
And I do feel very grateful and very insulated. I have a friend who just lost her mom, who was in a nursing home and very vulnerable. And but the stories aren't, I feel like if this were a more lethal virus, it would be there would be no silver lining to this time off, because we'd all just be gritting our teeth and, just white knuckle the whole time, and
Stressful.
that we're lucky in that way. But as these new reports are coming up of, blood clots and amputations and strokes, and that makes me even more grateful for Tony Fauci than I
Yeah,
was
thank God.
at the very beginning. Yeah.
Yeah, no, I mean, I think exactly one of my really good friends from college is actually an ER doc at Elmhurst, kind
Oh
of ground
wow.
zero, right? I mean, that is like,
Total
and
ground
and
zero.
it's funny, I'm trying to get her on this podcast and she's resisting because she's just like, look, I'm so traumatized. It's been the worst, 8 weeks of her life. Her interactions with her kids, she's isolated. She doesn't go and eat with them. And she's having an experience that is completely out of this world. I think, we're fortunate to have people like that, honestly, and it
Oh
just
my God.
shows how lucky we are as a human race that people are really giving of themselves and they're not like hiding and leave, because without people like that we would be really
And they're
in
also
trouble.
doing it without the right amount of protective
Oh yeah,
equipment, and they're having to do it knowing that they could get it at any time. And
yeah,
they've had to take care of colleagues that have gotten it.
yeah,
I can't, yeah, it's an unimaginable trauma.
yeah,
An unimaginable trauma.
yeah.
I agree.
So today I wanted to kind of just like always, we want to give an in-depth kind of understanding of people who are interested to learn a little bit more about coronavirus and how it impacts the skin and
Sure.
dermatology practice. And we're going to get into the whole we're really going to focus on kind of your world of
Okay.
dermatology and what you think you're going to be seeing a lot of as you get back into your practice. What are some of the stuff that you've heard and you've seen be impacted in terms of your skin with
Yeah.
coronavirus? And
Yeah.
I know the Italians have a lot of information and so forth. But
Yeah,
what
they
is
were
that?
actually
Yeah,
the first to report it. There was a doctor, an Italian doctor, that looked at 88 patients, and about 20% of them had rashes. But rashes are very common with with any kind of viral infection, and they're usually sort of non-specific collateral damage of a heightened immune system, and that, like hives, for example, you can get hives from certain foods, from certain medications, from an upper respiratory infection, etc. So hives is one of the things that has been described. Vasculitis, where there's an inflammation of the blood vessels and a little blood leaks into the skin. So you get little tiny pinpoint, it looks like bruises. They're not just red, they're deep purple. When you push on them, they don't blanch like something that's just red. But there's also been rashes that look like the measles or chicken pox or a little bit vesiculated. There have been things that look like just big purple spots, but ones that blanch, where it seems like the blood flow is just decreased, not that you're leaking blood into the outer skin like you do with little petechiae. But luckily, so far, it's in a pretty small percentage of the population, something like 0.2, and it doesn't seem to have any correlation with the severity of the disease. The thing that we hear about the most are COVID toes. You've
yeah.
probably
Tell
heard
us
of
about
COVID
that.
toes.
Yeah, tell us
And
about that.
so it looks like frostbite, or what we call pernio, and so your toes get purple, kind of like they do when you're freezing cold, and and that's been seen mostly in maybe adolescents and 20-year-olds, but there's a lot of people were really scared of that at first, and I got, I don't know, I got calls from a ton of patients. My kids' toes look funny, and I looked at a lot of pictures of toes.
Yeah,
And then the pediatrician upstairs had a brother with athlete's feet, which can present as kind of a purple blister on your feet. so she sent that kind of panic. This is my brother's foot. Is he okay? Does he need to go get tested? The odds of you presenting with some sort of skin symptom that means that you need to run out and get a test are extremely small. So that's good news. And the rashes that we do see are rashes that we see with other viral infections that are pretty nonspecific and sort of come and go. The American Academy of Dermatology is keeping a registry now. So at the end of it, I suppose we'll have some stuff to look at. But it's not like, we don't know that it's clots in your toes that are forming that sort of purple thing. So it doesn't mean that the neck thing that's going to happen is some terribly horrible catastrophic thing. So that part's good news, and it's good for the parents out there to sort of know that they don't have to be watching for that. But it's not really a sign or symptom that is a cause for alarm, I guess.
Okay.
Is the best way to say.
I know one of my a friend of mine got this actually in Italy while skiing there a few months ago, and came here and was really sick, intubated and so forth, and got the frostbites on the fingers, and they actually had to unfortunately amputate part of the finger because of it. So I think this is, again, as we get more experience, as the skin is the largest organ of our body, and so many things can come about, and
So
we just don't know. Yeah.
Skin. And that when you think of stuff like psoriasis, you get these red patches that make too much of the top layer of skin, and it almost looks like you put wet oatmeal on there. But if you look at somebody's arm, or a place where you normally see psoriasis, it's in areas of constant friction. But what's really interesting about it is that it's so circumscribed that here you have like completely normal skin, and then there's just these few spots that seem to light up. So I agree with you. Skin is almost like a hammered out lymph node that's been draped over the whole body. And when anything's going on anywhere, the skin like shows itself up and does something. But in your friend who lost his fingers, in the people that are severely ill, I think that there's some evidence that there's some endothelial involvement, and that's what leads to a clot. Yeah. And in him, that probably was a clot that led to the amputation of his fingers. And that there was that actor that had his leg amputated from clots, and they've seen clots in the lungs of people that have been autopsied after this. And I think that's a very different thing than the COVID toe thing. And so I just want to make a point of that, because I don't think that anybody that's seen that. I mean, the mayor said a couple of days ago that there's testing available for everyone, right? Asymptomatic or not. And even as recently as 2 weeks ago, one of my medical assistant's husband is a phlebotomist in a hospital. He draws blood. And he came home sick and went and got tested, and he was positive. So she has 2 small kids, and she and the kids her husband had to be sequestered in one room while they sort of operated somewhere else. And they wouldn't test the kids. They tested her because of her exposure to him. Yeah. But they wouldn't test the kids because they were asymptomatic. And it was torture for her. So at least that's over. And we've got enough testing now that everybody can get checked. Yeah. And so, if your toes turn purple, go get a test.
But overall, the good news from what I'm hearing, it's a very low percentage.
Very low.
Individuals. So that's really important to know. And that's something that I want to kind of talk to our viewers and listeners. It's that there's going to be a lot of news you're going to hear, like scary news, but we have to look at the odds and the percentages, because every health issue has something that in a very, very rare circumstance you could get that, but not
Absolutely.
everybody will get it. So you have
It's
to
like
be,
when HIV first came out
yeah,
in the 80s, like nobody, the dentists were scared
yeah,
to practice and now we know that it's not, you're not going to stand behind somebody at the grocery store and get it. But
yeah,
that we do, I do have to say, the medical community has made enormous strides in such a rapid way.
amazing.
This virus, it's amazing. It's amazing. And the promise of remdesivir so quickly
Yeah,
after the emergence of this thing, it was nice to see again Tony Fauci talking yesterday about the controlled studies that look very
coming
good
out.
and
Yeah,
positive. And I don't know how quickly they'll be able to
perfection of
be
it.
able to ramp up production of that drug, but it makes me feel a lot better that there's something out there that we now know through controlled trials will work.
Well,
And maybe
yeah, the good thing is I think it's a major biotech company, Gilead, that owns it.
yeah.
So I think they'll be able, and it's already, I think, out there. So I think they're going to be able to ramp it up. Whereas if it's a very new drug, then they got to create, a place to build it or develop it, and that takes a much
That's a
longer
really good point. Yeah, because
bit
it was
of time.
developed for Ebola, right? And then it didn't work that well.
Yeah,
But they've already got, all of that stuff is already ramped up. So
yeah.
they can go straight into
I think it'll, if it ends up working,
yeah,
I think it'll be a great tool. Let's
yeah.
change gears a little bit because
Okay.
we're all kind of getting geared back to going to work and
Yeah.
seeing patients again. And obviously, both of us have practices that have patients that are seeking attention for medical related and for cosmetic related
Yeah.
stuff. And obviously, right now, to think about, oh my God, I'm going to go do Botox for someone while people are like at Cedar Sinai intubated, it's a little difficult, I think, for everyone, all of us, especially, I think the most conscientious doctors like yourself to really think about. But it is something that I think people are going to start thinking about, just like going to the hairdresser and getting your roots or getting a haircut, whatever it is, people want to kind of start going back to some level of normalcy. So
Yeah.
I want to kind of, for our listeners, really give them some guidelines and guidance in terms of what they should be thinking about doing, when, and what they should expect their doctor's offices to do to ensure their safety.
Yeah.
So
There's a ton of discussion about this among all of the professional societies, the dermatology, every medical specialty, all the surgery specialties,
yeah,
for one thing, you don't want to get anything from the people that are coming into the office, and God forbid, you don't want to get it and be asymptomatic and spread it to people who come to your office.
because that's the most
So,
dangerous group, both from a
yeah,
physician standpoint, nurses, as well as patients
yeah,
and the
yeah.
staff.
Yeah, exactly. So the availability of widespread testing will play an important role in that. So just being able to get tested, whether you're symptomatic or not, in the city, we'll send everybody there. All of my staff will go and get a test. I'll go get a test before we start bringing patients back into the office, for sure. How much availability there will be to test over and over again remains to be seen, and we've got to wait for that. We can do some of the precautionary things that were done in airports, where you take temperature, because you can do that without even touching the skin. The
We
way
just
that those things
bought
are
a
made.
few of them.
Yeah.
They're very effective.
Yeah, yeah. And I think the office flow will be incredibly important, and nobody, like, we'll take all the magazines out. We'll take all the skincare samples out, nothing that everybody else has touched. And I think we might try and make a thing where there's one way that you come in and one way that you go out. And then we're going to have to book very sparsely so that there's not a lot of people in the office at the same time. And I think everybody's been talking about just having patients wait in their cars, and they can call and say, I'm here. And then we can call them up one at a time and put them in an exam room. And those exam rooms will have to be wiped down with bleach and in between every patient. Some people are putting UV lights, UVC lights in their exam rooms, just as kind of an air filter to kill anything that might be aerosolized, and everybody's going to wear masks. So there are some things, Botox is an interesting thing. A lot of people grind their teeth, and it can be very painful, and you can ease that a little bit. And I've had a few calls about that during the time that we've been off. As far as medical things, looking for skin cancers and taking off skin cancers, and I think that's going to all come back a lot faster. There are some offices that are opening up as early as next week, but I think the majority are opening up in mid-May. But they'll do that with the same, that we'll just be able to see less people during a day so that we can sort of do everything to make sure that nobody's being exposed to anything that the person that sat in the chair before you may or may not have had. And then I'm going to throw that back to you, because you were telling me a little bit about the number of people in the population that had this, say in New York at the height of this, when we first closed everything in mid-March, was fairly high. And but hopefully some of the social distancing that we've done over the last several weeks has brought that number down. And then the number of asymptomatic carriers in that smaller number will make it smaller still, so that it really does take the odds down that you'll be exposed to it. And as far as non-essential businesses opening, I think the doctor's office will be one of the safest ones. Even if restaurants have tables 6 feet apart, it's not quite the same. And so it'll be a good way to get it going. But I think it'll be very, very slow, cautious reopening.
Yeah. I mean, I think the way I look at it is there are low risk interactions and high risk interactions, right? Low risk interaction is like for you and I, if someone's coming to our office, we're doing, let's say, consultation. That can pretty much be done most of the time, actually, not coming to the office. We could do that telemedicine. But talking to someone is a relatively low risk opportunity. Doing Botox, relatively low risk. People can have their masks on, and so forth. Now, as we get into a little bit more of a high risk opportunity, is maybe laser treatments are a little high risk because they could aerosolize tissue. Okay.
Yeah. And plus you're right over their face when you're working.
Exactly.
And
surgery, intubation, putting a tube in, higher risk. Nasal
very much so.
Nasal scoping, looking with a telescope inside someone's nose, let's say for a rhinoplasty,
very high risk.
Could be a little bit more high risk. So for me, the way I'm looking at it, if someone is coming in for a low risk process, then it's use your standard stuff that we talked about. Like we're going to DocuSign all the consent forms, everything. So people don't have to pick up the pen, get everyone's credit card information before they come in. So we can run their, bill. They don't have to sign anything. They don't have to stand around. They're going to wear a mask. We're going to wear a mask. They're going to come in. I mean, I'm going to really see about one patient an hour, the way I'm planning. And then I'll do one telemedicine per hour. So that way I'm seeing the number of patients that I need to see, but there's only one person in one room. So they're going to come straight in and go into the room, then we're going to see. But anyone that's going to have a higher risk process, then they need to go and get tested beforehand. We are also going to test all our staff on a regular basis, including myself, so that we're not transmitting anything. So I think that's where I see. And right now, testing is still tight. So obviously not everyone is going to be able to do it. But that's where I see the future, meaning future in a few weeks, being where high-risk stuff, they got to get tested. the swab in the nose, maybe the antibody, whatever it is that we decide on. And then lower risk stuff, just really universal precautions that we actually kind of know how to do already because of our previous experience.
Yeah, yeah. With HIV and
Yeah.
hepatitis C, and I mean that's something that we do every day anyway.
Yeah.
But you're right, because this is transferred and through the respiratory system, and to take off that map and that mask while you're right in somebody's face is a danger to both of us, and that may not be the time to do that.
Yeah,
If
I
you
mean,
put a little Botox with the mask on, anything that this has been a difficult time, and that there's some studies with Botox and depression, and they're interesting studies because it's not like you look in the mirror and look cranky and sad that makes you sad. It's a feedback loop. So you can even if your brows are really tense, it makes you feel more tense. And if your brows are less tense, you feel less tense. So there's a signal between the brain and this position that goes both ways. You can even actually just lift your brows and feel better.
Feel better.
It's sort of amazing.
That.
Yeah, it's sort of like your grandmother telling you, just smile a lot.
Yeah.
Smile a
No,
lot.
it's true. Smiling releases endorphins.
Yeah,
It makes
it makes a
you
difference.
happy.
It makes a difference.
And there are a lot of Botox treatments, like you said, for non-cosmetic reasons. Like I do a lot for patients who have facial paralysis.
Yeah.
We do a lot of masseter. We do a
Yeah.
lot of masseter for trismus and TMJ
Yeah.
issues and
Yeah.
or migraine treatments. So,
and luckily I think that's possible, because you're sort of on the side of a mask,
Yeah.
and then anything that you do on the body where you're not as close, and that if you want to do cool sculpting or cool tone and stuff like that, I think. But some facial fillers, especially in this area, I think that'll have to wait a little while.
the question I have, and this we're going to go back to medical for a second, because how about, I mean, there's still like a lot of teenagers that are on Accutane.
Yeah.
They need their blood work and they need, certain thing. That's why the only thing, I mean, I'm happy about loosening of restrictions on medical practices. Not only, of course, someone has skin cancer, it could be a melanoma.
Yeah.
And, 3 months can be a huge difference. But also we have all these other medical issues that we just can't get too far behind.
No.
Do you know what I mean?
Right.
And,
Yes.
maybe somebody, a teenager is taking their medicines, but their liver function tests aren't being checked when they should have been checked. So maybe you could.
That we've been doing by
Yeah.
telemedicine all along, because you can't stop and start that therapy. I mean, once you've started, you need to carry it out for 6 months and finish. When you brought up teenagers with acne, the masks have been so bad for acne because it just rubs your face.
Oh, yeah, tell us about that. Oh my God, I didn't even think about that.
So many pictures, so many people have like, what is this? And it's always in the exact line of where the mask hooks onto the face. And everybody's rosacea is a different kind of acne. Like regular acne is kind of a waxy plug, which is why if you pop the pimple and get rid of the plug, the whole thing clears up. But rosacea is a form of acne that's just inflammation. And there's a genetic component to it. Some people are with, the sort of stereotype is sort of a Germanic looking, blonde haired, blue eyed, fair skin that gets really red, or Irish skin, but even people with our complexion can get it. And stress really dilates those blood vessels and makes rosacea really, really flare. So a lot of that too. And it can be incredibly severe. Bright red with pustules all over your face. It's just nasty and horrible. And and we've seen quite a bit of that during this time too.
So what's your recommendation for people who are going out a lot and wearing masks to take care of their skin and prevent or help minimize these issues?
Yeah, I think we just have to you have to stick with your skincare routines and use retinols and salicylic acid and benzoyl peroxide and all the stuff you normally do. It's interesting when you're home for a long time and you've got that big stretch. Like I've worn the same sweatpants and t-shirt for more days in a row than I would care to share with the general public. And then people send us a picture and they're like, I've got these little bumps all over my back. And I'm like, yeah, I know why, because you've had the same t-shirt on for 5 days too. And this, I don't mean to get gross, but like if women are working from home and they just quit wearing a bra, in runners that do marathons, just the movement of the t-shirt just rubs them raw. So the whole areolar area gets really raw and nasty looking. And there's a rare kind of cancer that can present like that. So I did get one panicked call by somebody who looked it up online and thought she
Oh
might
my
have
God.
breast cancer. And I'm like, you're not wearing your bra in that t-shirt, are you? And she's like, how did you know that?
But it's funny, like myself, I usually, like when I go out, because I walk a lot to work, I
Yeah.
always put my sunscreen, and I'm walking a lot, but I forget to put I'm like peeling here and here. I'm gonna
Yeah.
need your help
Yeah.
badly, Becky, honestly. Like every day, you know what my mother-in-law says? You are getting little
Oh
wrinkles
God.
there. You gotta go to Dr. Fitzgerald.
They don't
You're a
hold
plastic
back, do they?
surgeon. Your
They
patients
don't,
are going to want to see an old
they
plastic
don't hold
surgeon.
back. Older women in general, but certainly a mother-in-law. Like, what happened to you?
Oh
But I
my!
have to tell you, I did the same thing to my sister-in-law because she's Germanic, and her face was like it just turned into like a red beet with big. It looked like mosquito bites all over it. And as soon as I saw her, from 6 feet away on the sidewalk, I'm like, oh my God, what happened to your face? And she's like, nice to see you too.
Oh my God! I know. We kind of stopped. That's going to be interesting. I think when people get back to their normal, lives, I
Yeah.
think they're gonna like be jumping to come and see you and myself and go to their hairdressers and do,
The hairdressers are
yeah.
going to be one of the big aesthetic companies, Allergan, the makers of Botox, has been following what's happening in China very closely. So because they reopened and they're about 7-8 weeks ahead of us, right? So of all the aesthetic practices, I think over 80% have opened, and the traffic in the offices is about 40 to 50%. And but hair salons are like 7 to 10 times busier than usual. And I totally get it because I want to be at the front of that line. Everybody does.
Well, my mom is a hairdresser. Did you know that?
Oh,
Yeah.
I
So,
didn't know that.
yeah.
I
So
just
my
forgot
mom,
about it.
is in her 70s, and she is like planning the whole process of when she's gonna do it like a medical office. Yes, we're
Oh,
gonna lock the
wow.
doors. They're gonna call me. They're gonna come in, and I'm like, oh my God, yeah. So I think you're right. They're gonna be very, very, very busy.
Oh yeah, those will be because you keep seeing things on the news, the celebrities that have gone gray, and it's just unbelievable,
Well,
and it does a number on you. Like it starts to affect your mood. So I finally had to get my hair person to mail over some of my hair dye, and I got my 16-year-old niece to put it
your
in.
hair looks
It took me
great.
an
I
hour and a
like the
half, but
color.
it was,
I
it
like
was
the
really a
color.
lot of fun. She's like, maybe I'll do this.
Well, the funny thing is, my mom has been literally the only person who's ever cut my hair. Like,
Oh
with the
wow.
exception of once or twice in my life, like for my wedding, I went to somebody, but we're like socially distancing from her, and I was getting a haircut by my mother-in-law, my sister-in-law. They were doing the two sides, and Jessica, my wife, was like coming,
Yeah.
and it was like as if it was the greatest feeling ever. She was like going and cutting my hair, I'm like, take it easy. so so yeah, it's been, I think this is, we'll never forget this era. Hopefully
No, we
everyone and
won't.
their loved ones are healthy and safe, and the medical side of it, I hope, goes away really, really quickly. But This is definitely an era that none of us will ever
Oh
forget.
yeah.
So
And it's far from over.
yeah,
In the next few months, the whole working while social distancing is
yeah,
going to be, it's going to be a very, it's just going to be a strange environment. And restaurants with tables that are far apart,
yeah.
and the normal life will definitely be
Take a
a
while.
new normal. But
Yeah,
I think it'll be a transient,
yeah,
normal.
no,
And we'll get through it. We're strong. We're just, human nature is so resilient. It's amazing. That when you think about that 1918
yeah.
pandemic,
I always think about that.
oh my gosh,
Yeah,
I can't even. And how did it spread like that? And like infect 30% of the global population.
yeah,
There were no planes. There were
yeah,
no cars. You couldn't even. That must have been quite something to live through. And polio before the
yeah.
vaccine. I can't imagine every time your kid sneezed, you had to worry that
Oh my
something
God.
that dreadful would happen. And
Yeah,
I think that this is a very challenging time. I think that luckily we're up to the challenge, and that we'll make it through.
I,
And that's not to say put on a happy face when you don't feel
yeah,
happy. I think it's important to feel your way through it. I mean, I have my good days and bad days. I'm a little better when it's sunny. When it gets gray outside for 2 or 3 days in a row, I'm like, I can't believe this happened. How
we're
long
lucky
do
we're
I?
in Southern California and there's a lot of space and it's not, it's not super congested and
Yeah,
we should be very grateful,
yeah,
for what we have in our lives.
yeah,
I want
yeah.
to thank you, Becky. This has been awesome. And as always, I love catching up with you and you're just an amazing person, physician, all around, just like,
You're the amazing
no,
person,
no, it's
physician,
like
and look
such
at
a
what you're doing with your spare time while
no,
you're
this
gone.
is fun. This is like
It's just
my
great.
fun. This is like this is instead of going and golfing, I like doing
Yeah,
that. So,
you're good at
so
it. So
I
thanks for
appreciate
having me.
your
I
time
appreciate it. Oh,
and
sure.
for all of our listeners, please um, uh, leave us a comment, suggestions, rate us, follow us, and we're gonna actually have a lot of and we've actually taped another podcast that we haven't actually published yet. So
Oh,
we'll put
wow.
that out in a few weeks, but
All right.
hopefully you guys will have gotten some information today that was useful, and we look forward to seeing you and hearing from you soon. Thank you, Becky.
You're welcome. Have a great day, and don't worry about purple toes.
Okay, got it.
All right.